Hello, this is Dr. Pankaj Jindal. I'm a hand surgeon in the city of Pune in the state of Maharashtra in India. Today we'll talk about Rolando fracture. Rolando fracture is a fracture at the base of the first metacarpal. It's an intra-articular fracture, and the third thing is a comminuted fracture. As against the Bennett fracture, where there are only one piece, more than one piece will make it a Rolando fracture. How do you treat it? Since it's unstable injury, they require surgery. You can treat it with the Kirschner wires if the number of fragments are 2 to 3. Often it will be difficult, but there are other options which are available. If up to 3 pieces, you can use K wires or plates, but more than 3 pieces will require some other option, and the option that is available with us and gives good results are external fixator. So we have a clinical situation where the number of pieces are 3, and this is by definition a Rolando fracture and not a Bennett fracture. How do you treat it? Traction to overcome the pull of the abductor pollicis longus, rotation of the thumb so that the pulp of the thumb faces the pulp of the index finger. It is pushed medially so that the fracture fragments can be seated nicely. K wires across the CMC joint and K wires across the fracture will make it stable. But if the fracture is comminuted, it requires other option, and the other option is external fixator. So if you see the X-ray on this side, you see multiple pieces of the base of the first metacarpal. If you apply traction, you can overcome the pull of the abductor pollicis longus. So how do you do it? This appears to be confusing, but it is not. The first hold is on the second metacarpal. Multiple clamps are used so that the wire does not come loose. Second hold is with a set of external fixator wires and clamps, which is having a purchase on the first metacarpal. The set of clamps on the second metacarpal and set of clamps on the first metacarpals are attached to each other with another rod, and these two rods, one rod having a purchase on the second metacarpal and one K wire having a purchase on the first metacarpal, are distracted. As the distraction is performed, the metacarpal 1 gets in place and you can get the alignment restored of the metacarpal combination. So this is how this patient had presented. Kirschner wire and external fixator was applied, and we could restore the articular congruity, as you can appreciate, on the lateral side, on the medial side, using an external fixator. Did it work? Sure enough, this is how we began, this is where we ended, and this is the range of motion we achieved out of this metacarpal comminuted fracture. So in summary, combining the injuries to the metacarpal 1, whether that's a 2-piece or more than 2-piece, a 2-piece fracture is a Bennett fracture, more than 2 pieces is a Rolando fracture. They all are unstable injury because of the traction of the abductor pollicis longus, and they almost always require surgery. Conservative treatment is likely to fail and therefore offer surgery. If you are not operating, take serial X-rays. I thank you very much for patient listening. If you have any feedback, please do share with us. Thank you once again.